Earlier, as you received notice from the Massachusetts Department of Public Health, there's a patient in the Commonwealth of Massachusetts who has been confirmed to have infection with monkeypox. That patient is currently hospitalized at Massachusetts General Hospital and is admitted to our special pathogens program. He is in stable condition.
So the patient was placed in an airborne infection isolation room in our special pathogens unit. We're using gowns, gloves, and 95 respirators and eye protection. And this is personal protective equipment that our staff are very familiar with. This is same personal protective equipment that we use when we take care of patients at risk for COVID. It is a rare infection, originally identified in the 1950s in monkeys, and then the first human case in 1970. Most of the cases have been reported really out of West Africa or Central Africa. The cases that have been outside of that area have been reported to be related to travel or to animals. I mentioned rodents. Well, there was an outbreak in the United States in 2003 involving many states, and that was associated with prairie dogs. In the last year, there have been 2 cases in the United States in November and then in July. Both of those were associated with travel.
I think it's important to know that this is an evolving situation where in the past 2 weeks, we've seen a number of cases without a reported travel history to West Africa, which has been the travel that's been most relevant. So right now, we don't have that travel history. We don't know how the patient acquired this infection, and that's why we're working closely with public health authorities.
A lot of the clinical symptoms to really watch out for. So, for example, patients can present, as Dr. Shenoy highlighted, with flu-like illness and other sort of very general fevers, chills, and an unexplained rash and lymphadenopathy. Those are the more classic symptoms. So really elevating knowledge about those, and then also the epidemiological risk factors in accordance with those, right? So thinking about travel to a country where cases have been identified, thinking about close contact with someone who's been diagnosed with monkeypox or suspected to have monkeypox, and then also men who have reported sexual contact with other men. So those are the big 3 epidemiological risk factors.
People should not be afraid of monkeypox right now. The current patient is of no public health risk right now, and people should just be aware of symptoms, but not be afraid in any way.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.